When we think of feces, it's not the most enticing thing, nor is it seen in a clean light, to be literal in that aspect. It's something when we look at feces, we are immediately disgusted by it. But now that there's a lot of studies that the feces is a good indicator of your gut health. Fecal microbiota transplant, or FMT, as the acronym suggests, it is essentially getting the feces or poo of one patient and we transplant it into another patient. Usually we get it from a donor and then give it to a patient who may be experiencing more or less chronic diseases from your mouth all the way down to your colon. Has its own microbiome. It's basically a universe of its own bacteria. And you have some good bacteria and you have some bad bacteria. All these other bacteria strains. So they are in what we call a diverse state because you have that good and you have that bad. And you want to have more good, definitely, rather than bad. So your good bacteria, you can think of them as your soldiers that are fighting against these bad bacteria so that you can keep your functional state at its optimum function. As I mentioned, if you have more bad bacteria, you have a chaotic environment. So that causes a lot of dysbiosis and causes inflammation. And inflammation can result into ulcerations, to bleeding, and that also, in effect, will lead to malnutrition and weight loss for patients unwantedly. The usual GI symptoms may that be coming from nausea, vomiting, bloatedness, reflux, constipation, as well as diarrhea. All of those will technically be addressed by that transplant. So, especially since you're a patient, you must have at least some GI symptoms for us to even think of doing such a process. Hence, if we do this, it would address those certain symptoms. May it be from bloatedness, constipation, usually blood and stools. So those are the things that would be, hopefully, we would be able to see. So once we have identified the patient that would require a fecal microbiota transplant, we will look for a donor. And that donor will go through rigorous and thorough screening as well. Once we identify that, and we will identify him or her as what we call a super donor, we will basically take feces and transplant it to the patient via colonoscopy. So we'll have the fecal material. We'll go through the process of a colonoscopy for the patient. As we know, the colonoscopy goes up all the way up to the cecum. Then from there, we will be basically deploying those fecal material into the gut. So that would essentially take place for that transplant to happen. So that if you're eating well, that means your gut is being healthy. And as I mentioned a while ago, it has its own nervous system that is connected to the brain. If you have a healthy gut, it's able to optimize the nutrition, and you get your neurotransmitters, your enzymes, your vitamins, and all the necessary carbohydrates and proteins and all of that. Once that's absorbed by your body, your metabolism and your hormonal functions are then also in more optimal states.